This morning, the hundreds of thousands of COVID breakthrough cases that have America on edge have now burst into the halls of Congress. 3 vaccinated U.S. senators, Roger Wicker of Mississippi, John Hickenlooper of Colorado, and Angus King of Maine, revealing they've all tested positive. King noting in a statement, "While I'm not feeling great, I'm definitely feeling much better than I would have without the vaccine." Hospitals nationwide reeling from new COVID cases, with 9 out of 10 of those patients unvaccinated.
We're likely about a month away from COVID-19 booster shots becoming available for fully vaccinated Americans. The FDA still has to give its approval, but Biden administration health officials say a booster shot could increase COVID-19 antibody levels by at least tenfold. Studies have also shown that vaccines are less effective against the Delta variant and that antibody levels decrease over time.
Take a look at this headline from the Washington Post. Vaccines alone won't solve the pandemic. Here are 3 other things we must do. It was actually written by members of the Biden Transition's COVID-19 Advisory Board, and they say we need more treatments ASAP. We're sharing 3 new COVID drugs in the pipeline that could help end this pandemic for good.
What's going on, YouTube fam? It's Ron here with your daily news update, plus our hot stock tip on pharma biotech company Moderna, thanks to talks of a cancer vaccine. Wild, right? Definitely stay tuned for all of it. But first, I just want to say welcome back to all my subscribers. I really appreciate you guys. And for those who are brand new to the channel, my name is Ron. We cover all things personal finance, investing, cryptocurrencies, stock market updates, and of course, stimulus check updates and stimulus package updates. So if you have not already, definitely hit the subscribe button and tap the notification bell. That way you're notified as soon as I release new videos and updates. And let's go ahead and jump right in, guys. Great news.
We're sharing 3 new COVID drugs in the pipeline that could help end this pandemic for good. So please do not go out and start taking these things yet. Starting with a drug called colchicine. A lot of you know it. It's typically used to treat gout. But one study from Canada found that colchicine reduced deaths by 44% and reduced hospitalizations by statistically significant 25%. So Dr. Yasmin, colchicine is cheap. It's widely available. How could this simple drug transform our approach to this pandemic?
And anyone who's had gout, Dr. Oz might recognize the name because it's a treatment that we use for that disease. However, even though there is some evidence that it might reduce mortality, many are saying it's still too early and that we don't have strong enough evidence to say that colchicine definitely would work as a treatment against COVID-19.
An antidepressant called fluvoxamine. Dr. Yasmin, why do researchers think an antidepressant could help with COVID?
So this is another example of a medicine that doesn't attack the virus, but tells our immune system to calm down. So anyone watching this, think about the last time you had flu or you had a nasty infection. Some of those horrible symptoms that you had, the fever, the chills, the headaches, were not actually caused by a virus itself. Those were caused by what we call cytokines, chemicals that our immune system releases to try and attack the virus. But those actually end up causing our symptoms. What some scientists are thinking is that this antidepressant may not work against the virus, but could calm down those cytokines that cause the nasty symptoms that make us feel sick.
Back in November, there was a massive COVID outbreak at the Golden Gate Fields racetrack in Berkeley, California. Right? There are 113 workers in that facility. They were offered 2 weeks of therapy with fluvoxamine, this medication. Of the 65 people who took the drug, nobody, not one person, had to be hospitalized or had serious symptoms. Meanwhile, 6 of the 48 workers who turned down fluvoxamine had to be hospitalized. 2 required intensive care, and unfortunately, 1 person actually died. Now, this doesn't prove that this drug is going to save your life, but I would think we'd be pouring a ton of resources into figuring out if this lead helps us. Okay, on to our last COVID-19 therapy under investigation, ivermectin. Now, this is a pretty cool idea. It's an anti-parasitic drug.
So Dr. Oz, where we are is looking at this medicine in test tubes and in petri dishes. And in those instances, but not in people, it has been shown to kill the virus.
Ivermectin is an anti-parasitic drug that has been recently touted as a potential repurposed treatment for COVID-19.
Your doctor has prescribed you ivermectin for preventing or treating COVID-19. Is it safe? The FDA does not approve the use of ivermectin for the treatment or prevention of COVID-19, but your doctor wants you to take it. Is it safe? I'm Dr. Rick Kelly, a practicing physician with over 30 years of experience in primary care. The drug ivermectin, long touted as a wonder drug, whose discoverers were awarded the Nobel Prize for Medicine, was discovered late in the 1970s by researchers in Japan. Initially, it was used as a veterinary drug and quickly became and remained a billion-dollar drug for over 20 years for treating certain parasitic infections in animals. In the late 1980s, it received FDA approval for 2 indications, and only 2 indications: the treatment of onchocerciasis, or river blindness, which in the 1980s was the second leading cause of blindness globally, and strongyloidiasis, which is a disease caused by a type of intestinal worms in humans. Ivermectin was also found to be effective against filariasis, a tropical disease that causes elephantiasis. But even though it's been used for decades for this indication, I see no evidence that the FDA ever approved it for elephantiasis. It was such a safe and effective medication that health agencies around the world gave it to people with little or no education or medical knowledge to take and administer to others. Since then, it has continued to be used for a wide variety of indications in humans and animals. But what does the FDA say about the use of ivermectin for COVID? An FDA webpage for consumers gives reasons why you should not use ivermectin for COVID-19 and some of the things that they think you should know about using ivermectin. First, it's not approved. As noted, the FDA only approves ivermectin tablets for 2 diseases, though it has been used internationally for decades for elephantiasis, which is not approved. It's also commonly used in the United States for difficult-to-treat cases of scabies, head lice, body lice, and pubic lice. None of those are approved uses, though the Centers for Disease Control, which is part of the U.S. Department of Health and Human Services, lists the appropriate doses for these off-label uses. Next, they point out that taking large doses of ivermectin can be dangerous and cause serious harm. The package insert for ivermectin states that dosages that amount to 50 to 250 times the normal dose have been found to be toxic and potentially fatal in animal studies. The FDA also recommends getting ivermectin, when prescribed, from a legitimate source. That is always a good idea. They caution against diverting medications prescribed for animals for use in humans. They state that you may have heard that it's okay to take large doses of ivermectin and that is wrong. Well, that is true. It's never a good idea to take prescription medications without consulting your physician. As far as I can tell, as of July 2021, only one of the treatments commonly used for hospitalized patients has full FDA approval for treating COVID-19.
According to a new announcement by Dr. Rochelle Walensky, who is the director of the CDC, the effectiveness of vaccines has been declining, specifically among people who received them early on. And after citing 3 new research studies, both herself as well as other federal government officials, they are now recommending that Americans receive vaccine booster shots.
We're likely about a month away from COVID-19 booster shots becoming available for fully vaccinated Americans. The FDA still has to give its approval, but Biden administration health officials say a booster shot could increase COVID-19 antibody levels by at least tenfold. Studies have also shown that vaccines are less effective against the Delta variant and that antibody levels decrease over time. So for more on these booster shots, the Delta variant, and the overall response to COVID-19, let's bring in Dr. Rochelle Walensky, director of the CDC. Dr. Walensky, thank you so much for joining us. And my first question is, given the Delta variant, the breakthrough infections that we keep seeing, what changes are you making in your day-to-day life, if any?
Well, good morning. Thanks for having me. We advised several weeks ago now that people who are indoor should be masking in indoor public settings. We're continuing to advise people who have not yet been vaccinated to absolutely get vaccinated, because those folks are the most at risk for severe disease, hospitalization, and death. And what we're doing right now is planning, looking at the data and planning for booster vaccines, in the month ahead.
You'll be getting your booster shot very soon, or have you gotten it?
I absolutely have not gotten it. I am absolutely waiting for the FDA and the CDC, and I advise Americans to do so. They will, be looking at the data on the 3rd dose, on the booster, and after they give their recommendations, then we will be rolling out booster vaccines, really to those who got it first, those who are most vulnerable to long-term care facilities, and those people who got it first.
Do you think once it is approved, once we start rolling this out, that this 3rd booster will be the last shot that we're going to need?
This virus has been very humbling. So I have a lot of indications that suggest that we may not need another one. But we will continue to follow the science. We will continue to follow the variants. I'm very hopeful that we won't need another one, but I don't, we'll absolutely follow the science to determine that.
Following the science, going back with our nation's history when it comes to science and epidemics, I want to talk about the AIDS epidemic, when the CDC started condom availability programs to help stop the spread of HIV in its tracks. Dr. Fauci has said that using N95 or KN95 masks will offer the best protection from COVID-19. So why isn't the CDC working on perhaps dropping hundreds, thousands of masks at pharmacies, at schools, or at transportation hubs, just a massive mask availability program?
That's a great question. Masks are generally available, and N95 and KN95 are increasingly available now. We need to be careful about KN95 and counterfeit, because many of the KN95s out there right now are counterfeit. And what I would advise people is to understand what they need in a mask so that they're able to tolerate it for some period of time. Certainly, if you have a high risk of exposure, if someone who you're caring for has COVID-19, you may want to consider a higher respirator mask like an N95 or a KN95. But it's also the case that those are really hard to tolerate for long periods of time. So if you're taking a many hour plane ride, for example, it will be hard to tolerate an N95 for a long period of time. And so in those situations, we have masks that are ASTM standard, that are multiple layers. You cannot see through them. They have a nose bridge, and they really cover your face quite well. And that also would be a really reasonable recommendation for masking.
Okay, but just to be clear, the CDC is not looking at rolling out a big mask availability program just so that anyone who wants to protect themselves will be able to grab one of those masks, similar to the AIDS epidemic and how we had those condoms available nearly everywhere.
Certainly something we can look at. We are not under the impression right now that mask availability is limiting mask use.
Okay. Another question regarding masks, regarding schools. With school starting, will the CDC have more data on what's driving the current surges in children being hospitalized? And really, what's your advice for parents who are worried about sending their kids back to school, especially in districts where officials aren't following the CDC's guidance?
Yeah, we've updated our school guidance. We absolutely know how we can keep children safe. So among the things to keep children safe are get everyone around those children vaccinated and get those children vaccinated themselves. We do know in schools that the vast majority of disease in these schools, when prevention measures are taken, are really coming in from the community. And then to keep schools safe, masking in schools, absolutely, distancing, cohorting, testing in schools to decrease transmission. Indeed, we are seeing a concerning number of children who are getting sick from COVID-19. But in many of those cases, and in most of those cases, it is because these prevention measures are actually not being taken.
Let's talk a little bit about the Moderna vaccine. The Washington Post reports the FDA and the CDC are looking into the Moderna vaccine and the very small risk of myocarditis as a side effect. What exactly triggered this investigation?
So we have a robust safety system for our vaccines, and several months ago we noted an increased number of reports of myocarditis with both of the mRNA vaccines, and that is where we updated. We worked with the FDA to update their label indicating this risk. I do want to emphasize that the risk of myocarditis from a COVID-19 vaccine is far less than the risk of myocarditis from the disease itself, and so while we have updated the guidance, the label for these mRNA vaccines, and we continue to encourage people to wait for the third boost because of these safety signals that we want to have the FDA review. It is still much safer to get the vaccine than it would be to be at risk for COVID-19.
Yeah, as we keep saying, the benefits of the vaccine far outweigh the risk. I think the question on all of our mind, when are we going to get out of this? How exactly do we get out of this? Is it testing? Is it vaccines? What is the pathway?
In my mind, the pathway is to unify as a country and to do the things that we need to do to protect each other, protect ourselves. So that is all of the strategies that we have. We are empowered now with a lot of strategies to get out of this. Vaccination is certainly one of them. We still have 100 million people who are eligible for the vaccine who have not taken the vaccine. Prevention strategies, as we know, the masking, the distancing, the hand washing, ventilation in schools. We can move together against this common foe, the virus, not one another, to end this pandemic. And that is what I think we need to do as a country.
All right, vaccines, prevention, and I assume testing as well is a big
Testing
element. One last question. What guidance should we expect in the coming days to be reevaluated given this week's new vaccine effectiveness data?
We are absolutely following the data in real time. The data that we published this week and that will be coming out next week are vaccine effectiveness data that were really up to the last week or so. We're following data on disease, on infections in vaccines, on disease severity in children, and we will be following those data and updating our guidance as soon as they are available.
All right, well, we look forward to that. Dr. Rochelle Walensky, thank you so much for joining us.
Thanks for having me.
Meanwhile, a university over in Connecticut, they're getting creative in the way that they're trying to get their students vaccinated. They are now issuing fines to their students of up to $2,000, and they are blocking the internet access if the students fail to get vaccinated. However, these types of tactics are not only being seen on college campuses. That's because 2 days ago, right here in New York City, a vaccine mandate has gone into effect. You must now show your card in order to eat at a restaurant, go to a gym, or take in a show. And disproportionately, this is affecting Black New Yorkers the most.
Stock tip of the day, Moderna shares have skyrocketed amid talks of the mRNA treatments for cancer and malaria. Shares of Moderna soared 17% to end the day at $484.47. Now, this is thanks to the news of its combination flu respiratory syncytial virus COVID-19 vaccine, and more excitingly, its 2 cancer vaccines in a 50-50 partnership with Merck. You heard that right, guys, a cancer vaccine that gets the patient's immune system to recognize specific abnormalities that are all the hallmark of cancerous cells, and then gets the patient's own immune system to attack the cancer. Definitely some exciting times that we live in, and Reddit seems to be following the buzz here, with Moderna topping their online chatter by a wide margin. If we're looking for an innovation vaccine maker to boost the portfolio of healthcare investors for the next 10 years, Moderna has lots of firepower in its pipeline, street credibility, and plenty of cash to make it all happen. And just to show you guys what I'm talking about, look at this chart, $484.47. It's up 572% in the past year. Now, of course, this is not investment advice. This is purely for entertainment purposes, but just consider it for a second.
These are very small, actually. I don't like all injection. Yeah. Very smooth. Thank you so much.
81% of Singapore's population have received the first dose of the COVID-19 vaccine. Jade Lim is receiving hers today, but unlike most who have taken the Pfizer, BioNTech or Moderna vaccine, Jade has chosen the China-made SINOVAC. She's not the only one. Since authorities announced that SINOVAC would be made available under the special access route, long queues have formed across the island at private clinics offering the vaccine. Over 80,000 people in Singapore have received at least first dose of SINOVAC. Then came this announcement.
From 10th August 2021, we will take a more inclusive approach in recognizing vaccines beyond the 2 mRNA vaccines. We will extend safe management and in-time travel concessions to individuals who have received these recognized vaccines.
This means people like Jade who have taken SINOVAC will now be included in Singapore's vaccine count. But here's the thing. Although you are counted as fully vaccinated if you take SINOVAC, the vaccine is still not part of the national vaccination program.
So this means two things.